Stop.
Hmm. Recording start. So this lecture is about basic anatomical where these terms are used in. For example, I am femur. For example, spinning in distal. How these terms will guide us during. First, we'll see the first example of IMP in. There is in the femur, and our target is so the landmark for IMP is the which fossa? This is your trochanteric fossa. What is the location of this fossa? If this is the greater trochanter and this is the lesser trochanter. Place. This is known as the trochanteric fossa. Location or the landmark of this fossa, you can enter with your eye in this direction. So for this normal grade, I am pinning the landmark is that is trochanteric fossa. So this is to know the meaning of the basic anatomic term like fossa. One more with the same femur is this is the femur and supracondylar fracture. This is supracondylar fracture. Just what we are doing, the cross pinning. Cross pinning. In case of to start with the cross pinning, first important point you should if you know the landmark, you can enter pins. The landmark is the condyle. This is the condyle and this is also condyle. Medial condyle, this is lateral condyle. What we have two pins uh, the condyle, 2.5 mm pin I have. So one pin will be entered from and one pin will be at this side. We will enter, then these pins are so technique is called cross pinning. From where they will come out, they will come out. So for cross pinning, you should know the important landmark. One for the entry, one for the exit. One for the entry and one for the exit. So This is your femur, and this is the greater trochanter, lesser trochanter. You have entered like this. So the entry point, and this is your exit. So what these points thing? These points are nothing. This landmark is known as the fossa, and this is known as the condyle. So these basic anatomical terms, these are just two examples using these terms for our orthopedic surgery. So terminology. Uh, First of all, these basic terms should refer is the ICR of Ox. This is the book name are given. So starting with that is process. So what is the meaning of this term? Process bony prominence. Bony prominence is called process. Example, the best example you already olecranon process. This radius and this is ulna olecranon process. So what are the orthopedic related with this olecranon process? Here, this is the humerus and there is one muscle connected with the tendon. And suppose this is your triceps. When it is pulling like this, pull. This is the direction of the pull. When this triceps pull, sometimes what happens because of the force, this forceful pull process from its position along with the tendon. So this avulsion fracture of. So what is the meaning of the avulsion fracture? This is radius and this is a process. In case of avulsion fracture, in case avulsion fracture get along with the tendon. So along with the tendon, it gets severed. So this is known. The correction orthopedic that is known as tension band. The surgical procedure is known as tension. So these two MCQs they have asked that avulsion fractures are commonly seen in uncervical process. What is the there will be tension band? Why? terminology is the process. And first example was, and fracture was avulsion fracture and correct tension band wire. The second example of this process, number two, is the temporal bone hyoid joint. Hyoid bone apparatus, which is related with the tongue. It is connected with styloid, or it may be connected with mastoid, or it may be connected with nuclear process. So all these are process. Process means a bony prominence. A bony prominence. This hyoid apparatus, which is having tongue, this is connected with the styloid process in case of and horse. Because in case of this styloid is absent, so what they have? They have mastoid process. So mastoid process is present in your process is connected with the hyoid. Pig. In case of pigs, there is one process in the skull known as nuchal process. That is so this is part of skull, that is part of temporal. This is hyoid apparatus. So this hyoid is connected with styloid process. This is connected with mastoid process in carnivore, nuchal process. These are the process. These are the bony prominence. So process is nothing but a bony prominence. There are different type of process. Different type of process. If it is and rounded like this, then it is known as tubercle. It is tubercle. What is the example? Lesser tubercle of humerus. Lesser tubercle of the humerus. When it is small but linear, just like a line, and it is then it is known as line. Known as line. If it is this thick and like this, thick, thick and lean, this process is known as ridge. Then this process is known as ridge. If it is horn-like, this process is horn-like, we call this corn. If it is hook-like, this is called as pterygobone heavy annulus. That is hook-like process. rough, sharp, and known as crest. So some of the examples: when it is rounded, it is tubercle, linear but thick, rich, horn-like cornu, and hook-like is it is elongated, and also, for example, this is the scapula. What is this? Spine. Then elevated. This process is known as this is known as spine. Example is the scapula. And elevated. When it is elongated and elevated, when it is rough and elevated, this is tuberosity. This is known. Example is deltoid tuberosity, where deltoid muscle is infected. There is one more. When this process is excessive developed, then the term used is the trochanter, where it is present in the female. Two type of trochanter: greater trochanter, lesser trochanter, and trochanter. Third. So these are the processes. Summarize all in line. Then process means bony prominences. If it is dead, it is called tubercle. Like a line, it is called line. If it is thick, ridge. If it is like a horn, corn. Like a hook, then hamulus. If it is called spine, your scapula. If it is called tuberosity. If not, it is called trochanter. Trochanter. If it is sharp, it is called crest. Crest. So whatever these processes, this list, sorry, all are non-articular. Are non-articular. This is very important for MCQ point of. They can ask the tuberosity, spine, hamulus. They are non-articular. True false statement. So all these are non. So after Studying this process, non-articular, non-articular depressions. They are known as fossa. In case of femur, this fossa is one of the landmarks to enter I am feeling, and this is also as a landmark to exit for your cross pinning. It's a very important landmark, fossa. Then phobia. This head of the femur, suppose this is head, this is having one notch. This. This is known as phobia capitis. Capitis. Which ligament is present? Capitis. In case of dog, this is ligamentum teres. Teres ligament is present. Then number 3, sulcus. Number 4 is groove. In case of humerus, bicipital groove, what is passing of which muscle? Biceps. This tendon is passing. Tendon of biceps. So these are depression. Like your fossa, your sulcus groove. One is cavities. But these cavities are articular. These cavities are articular. Like glenoid cavity. Obviously, it is articular. Like cotyloid cavity, hip joint cavity, it is also articular. Next is foramen. Next. This is a bone having nutrient foramen. So foramen is the hole from where it ends. Foramens are connected to the leg with then the term canal. The meaning of canal is foramens have a certain length, and they have a certain length. That is called a canal. Next is hiatus, a depression having multiple foramen. For example, one hiatus, one for the passing of the esophagus, one for the uh, and one for the vena cava. Suppose there are three depression having three foramen is called as hiatus. So these depressions, after this there is something articular, anatomical term. Articular, again we have femur. These are condyles, are known as condyles. The posterior side is condyle, and this is known as the trochlea. This is known as the trochlea. articular. Here, above the condyle, we have something epicondyle. This is also epi. These epicondyle, they are non-articular. They do not participate in any kind of joint. These are so one more significance of these basic terms I want to tell is the suppo- fee. This is greater trochanter. This is lesser trochanter. Femur, neck of it. This is a landmark. Which orthopedic surgery, that is FHN, femoral head and neck osteotomy. Femoral tummy. So hip, in case of hip dysplasia, this cavity is shallow. This head, suppose this big and that is shallow. So what will happen? Friction that may lead to pain. That may lead to pain. So the one of the treatment is the FHO, that is head osteotomy removal. It should be called as femoral head and neck osteotomy. Both are removed. But the important for this surgery is you this is the greater trochanter and this is the head and neck and lesser trochanter. Incision from greater trochanter to lesser trochanter of head and neck. So both this acetabular cavity, both separated, and after 2 to 3 months, there will be formation of a false joint. This procedure will give some kind of relief, pain relief. So this is the significance of knowing where is the greater trochanter, where is the, and why these are important. Because these are the landmarks for orthopedic. And even before starting this FHO surgery, incision, where to take incision. The incision is cranial greater trochanter. If you know the position of greater trochanter, should go cranially because cranial to greater trochanter there is head and so the position of greater trochanter acts as a landmark to start surgery of FHO. So where to take incision? To take greater trochanter. Then cranial to greater trochanter take your. After that remove the head and neck. these three, I explained the significance of this anatomical term like your IM pinning, your cross pinning, and your FHO surgery. Here, fossa was important. Here, your con or you can say more clear is the trochlear ridge. So, what is greater trochanter to lesser trochanter? So, these are just few examples. There are n number of orthopedics, and in those surgeries, this basic anatomy they will act as a landmark your incision and to perform your surgery. These are just few. So these basic terms, all basic terms you can read in by reading the bone of skull and scapula because there is one term spine, humerus, then and ulna, radius and ulna. Number femur and tibia. If you read only these 4 5 with all your basic terms like bone of the skull, there foramen, hamulus, cornu, everything is there. In scapula you have spine, in your lesser tubercle, you have condyle, in ulna you have process like you know, in femur you have fovea capitis like you have trochanter, and in tibia you have crest, tibial. All terms are covered by reading these 3 4 words, and the main as a landmark for the orthopedic